Month long, we're shedding light on breast cancer awareness, and this morning, health reporter Haley Hernandez is focusing on how Medicare coverage can play a big role in access to breast cancer screenings, treatments, and of course, support services. Good morning, Haley.
Hey, good morning, Zach. So I am joined with Jasmine Alberto, a licensed Medicare agent with Connie Health, to talk about preparing your healthcare plan. So first, what is Connie Health?
Hi, Haley. First, thank you for having me on the show today. I would like to let you know what Connie Health is, and we're the trusted advisors for seniors and people on Medicare. We assist seniors on their Medicare journey, helping them choose the correct plan for them, helping them afterwards if they have billing problems. So we have a whole care team of licensed agents and health experts that help them make these tough decisions.
Are you an insurance company?
We are not an insurance company. What we do is we connect seniors and other Medicare eligibles with the correct plan. With there being over 4,000 choices for them, it can be very overwhelming, not knowing what they need in coverage. So what we do is we take that guesswork out of Medicare, and we also don't work for the insurance companies. We work for them. So we help them make that right and correct choice for their healthcare needs.
Yeah, which is totally overwhelming, as you just touched on. So let's explain some of the basics of Medicare as far as mammogram eligibility.
Yes.
We could be all here all day if we talked about the basics of Medicare.
For weeks.
But as far as it comes to getting a mammogram, what does Medicare cover?
Okay, so the way it works is that it is a little bit of a complicated question and a little bit simple. When it comes to screenings, mammograms are covered at 100%. Now, what the person does need to do is they need to make sure that they are going to a doctor that has Medicare assignment, so they won't show up with a surprise bill at the end.
That's the in-network, out-of-network difference?
In-network, out-of-network, as well as it can be depending on their plan. So if a person's on original Medicare, they have to make sure the assignment. If there aren't more of an Advantage plan, then they have to make sure that it is an in-network provider.
What do you find is the most common thing that people are calling you about?
The most common thing is what their benefits are. Some people have been enrolled in their plan for years and they don't realize what their benefits are, or that preventative is covered at 100%. So it's more about there was so much difficulty in making that choice, and then there's changes every year. At this time, they should have received their annual notice of change. It's very important that they review it. If they don't understand it, they can call someone like us to help them understand that, a local agent, or they can even call their insurance company to make sure that they're understanding what is the coverage that they have currently.
I mean, I'm glad you can understand it because most people can't. So what are the steps that should be taken to help educate people?
When it comes to education, it's that preventative is key. Getting your preventatives done every year can be huge difference when diagnosed with either early stage cancer or late stage cancer. Even waiting a year without going for a mammogram screening can end up making a person being diagnosed with late stage cancer. The earlier they're detected, the more likely that they're going to have the ability to get it taken care of or live at least 5 years longer. So to us, it's about the preventative. It's covered, do it.
But most people hear these screenings and doctor's appointments and they just hear money. They think they're going to have to pay money. And we're talking about people who are on a limited income, so going to the doctor is not affordable. But you're saying that for most of these plans, they could actually be...
Well, for all of the plans. So when it comes to preventative and Medicare, if you are on any type of Medicare, whether original, a Medigap plan, or you're on an Advantage plan, preventative is covered at 100%. So please don't not go get your mammogram because you think there's going to be an out-of-pocket cost.
Yeah, I mean, this can be life-saving.
Definitely.
So what are some of the more recent advancements? What are you seeing in technology that people should maybe trust going now to get these screenings?
It really is. That's a key question. We have all, as women, have heard how uncomfortable it can be to get a mammogram.
Yeah.
But there is new technology. The University of Chicago has created what they call a U-curve mammogram, which is a 3D mammogram, and Medicare is covering it. If it's your preventative, it's going to be covered, as well as 3D and 2D mammograms are available now. That means that the diagnoses are clearer, which means you don't have to go, you know, if you've ever had one and you've had to go a second time, you're
because there's something questionable in the scan, so they make you go back and do it again.
Yes, and it's not just at that point having to go again, it's the waiting to go again and feeling like you don't know what might be happening. These new 3D ones are so advanced that those questions are not happening anymore. Can you have to come in a second time? Yes, but that is covered if it's still under preventative.
Yeah.
But not to mention, they're just so much clearer that those things aren't happening as much. So a more comfort and a better diagnostic system. I think that's what we see is coming up on the advancement. So that could be very, very comforting to a person to know they're going to go get their screening and not have to worry about it till next year.
I mean, that's a great advancement. That's a huge advancement. Do you find that most places in Houston actually have that kind of technology?
So there are coming. The 3D, yes, and then the curve, they are popping up more and more.
Yeah.
So check. Also, again, make sure that if you're on Medicare, you're checking that it is an in-network provider that you're going to, so you won't have that surprise billing. But yes, they are covered by Medicare, and when something's covered by Medicare, it's going to be available.
Well, I love those advancements because, yeah, the number one reason I think that people would delay it is because of pain.
Yes,
yeah.
comfort.
Discomfort, yeah. Thank you so much, Jasmine Alberto, for coming with Connie Health. We appreciate your time this morning.
Thank you for having me.